Or do you want me to do it right away?
I think you can do it right away.
Are we up and live now?
Yeah.
Hey guys, how's it going? We got Mike and Dylan here with a special episode of Drop the Mic. Good to see everybody today.
I think we'll just let a few more people hop in here. While we're waiting for some more attendees to hop in, feel free to add where you're tuning in from today. We'll give you a shout out during the video. If anyone's with us today, feel free to drop in the chat where you're tuning in from. Thanks, Stella. Great to see you. All right, we'll give it a couple more minutes here, and then we're going to do a deep dive into XL Health Plans. The primary focus of what we're going to take a look at today is the disappearing deductible. So, as many of you know, the disappearing deductible is the key driver of our XL Health Plans. It's what makes our health plans function and run as clean as they are. It drives the behavior. It reduces expenses for both the member and the plan. And so that's what we're going to be doing a deep dive into today is all things disappearing deductible, and then open it up for questions at the end. So let's dig right in here, Mike.
Let's do it, Dylan.
So as I mentioned, the biggest thing that we can do to incentivize and change behavior within the health plan is the $0 out of pocket, the incentive to the member, because me being a former patient, I can tell you that things add up in a hurry. My 1 year record is $1.5 million in expenses during the height of my cancer treatment. So incentivizing members with a $0 out of pocket experience that also comes with better quality care, lower member costs, and lower business expenses is how we can create that win-win-win for all parties involved.
Quick anecdote on that, Dylan. When you spent $1.5 million, I assume that wasn't even including the Keytruda drug because that was a clinical trial, right?
The clinical trial was 2 other drugs, but it was FDA approved by the time I started Keytruda. Yep.
Gotcha. Okay. No worries.
All right, let's move it along here. So by the end of this, you're going to know exactly how, for a lot of employers that we're presenting to right now, why XL Health Plans is the obvious choice. For one, it's easy for benefit consultants to market and sell. We make it easy for employers to implement. And as we've seen, we're coming up on renewal season here. While everybody else is handing out double-digit renewals, our first quarter renewals are looking like they're going to come in under 4% across the board. On that note, we are running a challenge. So for every 250 lives that our benefit consultants write with XL Health Plans in the fourth quarter, so it doesn't include 1/1, we're going to be doing a separate challenge for 1/1, 2/1, 3/1. You will qualify for that $2,500 bonus challenge that we're doing. All right, so now we're going to get into the good stuff. Try to eliminate any distractions, close your emails. I know I'm the worst at multitasking because we have some gold in here for you and your practice, the people that you're working with every single day. All right, well, you have the man himself here today, Mike Patton. Mike began, as many of you probably know, he was on a path to, he wanted to be the head coach of the Denver Broncos. At the time, his journey
Can I
started.
still get the job, Dylan?
They might be looking here in a few weeks. So he was working as a GA at Colorado State. He and I founded XL Health Plans. He's an industry-leading speaker, healthcare visionary, and benefits advisor, and is the expert at putting together the pieces to build these high-performance health plans. And then myself, I'm an avid baseball fan. I'm not the expert that Mike is when it comes to all things healthcare and health insurance. I am the chief growth officer and co-founder of XL Health Plans, but I do have years of experience working with benefit consultants. My past life, I worked for a vendor in the space that we still use today. So imagine if you could offer employees $0 out of pocket. What would that mean for them? How easy could that make a sale to some of your existing groups and some of the prospects that you're calling on today? In a world where we live in the spreadsheet, and what does it say at the bottom of it? Employers, consultants, everybody in our industry is looking for that key differentiator that can put them over the top, make their benefits package more competitive, and everybody's looking to reduce costs. As we are on the precipice of what could be a prolonged recession, employers more and more that we're talking to it's on the top of their mind, and they're looking for ways to improve their benefits to their employees and cut costs for the business. So if you could do that, how many more groups would you close this month, this year, or especially this fourth quarter? We've seen consultants that have started working with us early in the year, having never self-funded an account without, a carrier being involved, like United All Savers or Aetna Funding Advantage, close 10, 15, 20 cases in a single year, more than they ever have in all their years in the business put together. And so that's what we're talking about here, is the impact that it can have not only on your clients, but for you as a consultant in your business, the retention of those clients, and not having to compete on the spreadsheet year after year after year, trying to beat up the carriers to get to the bottom dollar. All right, so let's get into the disappearing deductible, because I know that is a key question for a lot of the consultants that we work with and a lot of the members on the plan. It's a little bit different concept, something that they're not used to. And so it does take a little bit more education on the front end, but the rewards on the back end more than pay for themselves. So at the end of the day, the disappearing deductible, it does a few different things. The first is it completely eliminates the out-of-pocket expense for the member. When we're redirecting or incentivizing members to go to Coral facilities for imaging or outpatient surgery, it comes with a higher quality of care. So just by taking that surgery out of the hospital, where sick people are running around there, infection rates are higher than what they are at ambulatory surgery centers or independent surgery centers, it automatically improves the quality of care. Our care navigation team has access to quality metrics built around volume, outcome, all of those types of things that they can share with the members when one of these occurrences comes up. With that come lower member costs, and in exchange for that reduced out-of-pocket expense, we know on the back end we're going to be saving that business, in some cases, as we'll show you later, upwards of $100,000 on a single surgery. It's possible, and it happens more than you think. So this is a story that hits pretty close to home. Mike, I don't know if you want to share it.
Sure, I will. I'm happy to. So, yeah, my dad got his hip replaced in the fall of 2019, and as you guys all know, a situation that the disappearing deductible helps prohibit against, which is he had back surgery actually earlier in the year. So, of course, he wanted to get his hip replaced the same year because he had naturally already met his out-of-pocket limit. And this is a situation that we benefits consultants all fear because we now have no incentive whatsoever for a member to ever care about how much money they spend on their health insurance plan. My mom is a primary care provider, as you guys may know, and she knew this surgeon personally. This surgeon had admitting privileges in Littleton Hospital. My dad was an employee of Lockheed Martin. Lockheed uses Cigna, at least at the time, I don't remember if they still do, as their administrator. And at the hospital, the total paid claim for my dad was 138 grand. And also something of note to all of you, my dad had a claim even with Cigna as the administrator, where he was billed $44,000 for a monitoring system, which is purposefully out of network. And you'll love this, Dylan. He managed to settle that claim. Luckily, guys, my brother is also an attorney who works in the healthcare space and worked for a firm that used to represent the hospital systems up in Mayo. And he sent them a threatening letter, almost like a RBP type situation. And they reduced their $44,000 out of network bill charge to my dad to $400. So, and that's a scenario that we don't run into with the bundles. And, actually, interestingly enough, my dad could have gone to, crazy enough, the exact same provider who Coral and Sono Surgery had available at a bundle, legitimately about 4.5 miles east down the road, where we could have got the same surgery for $25,000. And the reason that that's possible is because out of that 138K, my mom's friend, the surgeon, the general surgeon, he only made $4,000 out of that. And obviously, it's not just paid back to him directly; it's paid to his practice. He's got to take some out for medical malpractice insurance and all the expenses associated with him doing his job. And versus when they go to the surgery center, the group that he's a part of actually owns a piece of a surgery center called Dry Creek Surgery Center in South Denver. And so they're able to recover significantly more margin for themselves on the $25,000 than they are on the 138,000. So it's a very interesting scenario, but this tends to be the case all across the country.
Yeah, and so that's just a really good way of showing how the disappearing deductible realigns the economic incentives, not just within the plan itself, but within the system itself, aligning that somehow the doctor gets paid more money doing the surgery in their own surgery center than if they pay 6 times more and have it done in a hospital. It just doesn't make sense. And a lot of our industry doesn't make sense. So by realigning the economic incentives, that's how we can run a more efficient health plan.
Exactly, Dylan. And if my dad had been on a plan that looked like an Excel health plan, we could have potentially double saved the plan, right? Because, if he had needed that back surgery, we would have done the same thing and offered him up, hey, why don't you do your back surgery at this location rather than that location? And, think about the cost. I honestly don't even know what the cost of his back surgery was, but I'm pretty sure he also did that one inpatient. So I'm guessing that the total of his two claims was probably pushing $200,000. And the truth of the matter is we probably could have gotten both of them for under 50.
Well, let's go ahead and show how we can do this exact same concept in a few other areas of the health plan. So the other thing that XL Health Plans does really well, if you're coming off of United All Savers or one of those other, all-inclusive type, it's a path to self-funding, but it's not quite all the way there. When you're working with a lot of those carrier-based products, you're using their PBM, and that's a non-negotiable. That's what I ran into when I was working for script sourcing. I kept running into the same, what I kind of describe as two types of consultants, those that had never self-funded or level funded without a carrier being involved, or those guys and gals that knew how to do the unbundling, but weren't doing it in the small group space, however they define that. Under 50 employees, maybe it's under 100 or 150 in some cases. And so simply by carving the PBM out and doing working under a transparent model where the rebates are passed through. I've been looking at some claims data from some of the large carriers on quotes that we're getting in. And in some cases, I'm seeing Humira being reimbursed at north of $10,000 a month. The highest I had seen was $14,000. And so it's like just by moving to a transparent model, you know, in most cases, Humira, you're looking at about $7,000 a fill with a $1,500 rebate in there that's passed back into the claims fund. So right there, you're saving about 50% right off the top. And then, you know, we use and tap into the assistance programs that are out there, importation, anything like that further reduces that cost. So in some cases, when we can get the drug for free from the manufacturer, we can reduce what would have been $120,000 is now only costing the plan $20,000 all in, and the member gets that same prescription directly from the manufacturer at no cost to them. So that's a huge win. We had one 80 Life group in Georgia where we had 2 Humiras and an Orencia. All 3 of the members qualified because these are pretty rich programs. Often cases, you're talking 600% of federal poverty level, which equates to about, you know, $170,000 household income for a family of 4. So that in a lot of cases, we can get these members on alternative programs and drive significant savings. I mean, in the case of that one in Georgia, those 3 medications alone, we evacuated probably $250,000 to $300,000 in claims just on those 3 drugs. And then the last thing is just smart access to better medical equipment, better price points. So built within our plans, and as we'll get to here in just a minute, in terms of some of the specific occurrences that qualify for the disappearing deductible, the bottom line is how do we get to the best care at the best price when members need it? And so medical equipment falls under that same category. If you guys have any questions as we're moving along here, feel free to chime in. We are going to open it up to questions at the end here and address any and all questions that you have. So we're going to be wrapped up with our part of it here in a few minutes. And then we really want to address any and all questions that you guys have about our plans, about the disappearing deductible, anything that you're coming across as you're presenting our plans to clients and prospects. We want to make sure we get your questions answered. So often we get the question, what qualifies under the disappearing deductible? Off the top, our plans auto embed virtual telehealth and virtual mental health. And that's a $0 option to the members. It doesn't cost them anything to use. It's a 24/7 benefit. So they can talk to virtual urgent care at any time of the day, or they can speak to a counselor via the mental health side of things at any time of the day, any day during the year. The biggest thing that we see where we can drive huge savings in occurrences is what Mike alluded to before. The MSK and the orthopedic through many of you are probably familiar with the Coral platform. There's thousands of bundles on that platform across the country that our care navigation team taps into and guides the members that need those services during their time of care. The other ones, labs, we work through Quest and their program. On the lab side of things, the logo is on our ID cards. So members should definitely be presenting their ID card and showing that Quest Lab logo on the card so that it's so that they get the $0 benefit for their labs. Imaging is another one that people often don't think of as being a high cost occurrence, but I actually have my own personal story. About 18 months ago when I was going to get my 5-year cancer checkup, which as you all know is a big milestone in the cancer space, hitting that 5-year mark is a big deal. In my case, the 5-year survival rate on stage 4 melanoma, even to this day, is still under 15%. And so I was on a United plan at the time, and I got a note from my doctor saying that we're having a hard time getting your 5-year scan approved. And I'm like, How is that possible? So I made a couple phone calls only to find out that the plan I was on at the time wasn't going to approve the PET CT scan that I had had all the way through my cancer journey, because they said A, I was too far removed from the cancer event, and B, it was going to be too expensive. So they would only approve the full body CT scan, which isn't as good in terms of quality and picks up on the same level of things, because melanoma can be very phantomy and small. It's hard to pick up on. So I went in, I had the full body CT scan, and then I got the EOB back where it showed that the insurance company had paid $11,500 for that full body CT scan. On our plans through Green Imaging and Assist Health and a number of other bundles, we can get a full body CT scan in pretty much any market in the country for about $250 to $500 all in. So of course we would make it free to the member, because we know we're saving potentially 20x on that full body CT scan. And that applies across the board to MRIs, any other types of common imaging. We're going to have bundles in just about every market across the country.
Dylan, yeah, if you remember from last year, we were able to do an analysis on all of the claims on the state of Wyoming. And when we did that analysis, what we found was that the average percent of Medicare of paid claims on labs and imaging were north of 700% of Medicare for both lab work and imaging.
Yeah, I believe one of those was 700+%, and the other one was like 1100% was the average.
Yeah. It was the lab work that was actually almost 1100%. And that's one thing that's really important for you all advisors is that's a game that's played with the PPO networks, is like the lower the cost of the thing, the easier it is to mark it up and hide it. So obviously that makes sense that the labs have the highest percentage markup, because as we all know, you can go get these labs done cash pay at Quest for $30-40 all the time. So when you're out there and your plan is paying $500 for them, that doesn't always trigger reports, because we as benefits consultants, we build plans that look at all the claims above 500, above 1,000, above 1,500, above 5,000. So it's easy for them to sneak all these claims of $500 for lab work because nobody's looking for them.
But they add up in terms of the volume. So, yeah, that's just another thing that our health plan does and is embedded in automatically. Just want to make sure that everybody on the call, everybody who's presenting these plans, knows what's in them, because there's a lot of good stuff that we have built into these. I think, what is it, Mike, like 14 or so vendors we have cooked into our health plan right now.
Yep. And the program for that, as Dylan's referring to, is called the Quest Select program. So if your members are ever asking, there is a Quest logo on the back of the ID card. If the members go into the doctor's office, the doctor's office knows off that logo to bill Quest directly. ABA is actually not going to allow the claim to be processed through the network. If the claim comes in from Quest, we're going to have it run through our direct contract from Quest. And typically providers' offices are going to know when they see that logo on the card, because most of the Medicare Advantage plans actually require one lab or the other. So they're going to know to send the lab to whoever's on the back of the ID card. Then we're going to bill Quest directly, and that results also in no cost share for the member, because we know we're paying a very low, a good pricing schedule, pretty much akin to RBP, probably slightly lower on the all the lab work.
Perfect. All right, so next up is diabetes. So one of the key partners that we have built within our plan is called DiaThrive. They do diabetic testing and coaching. So they help get monitors in the hands of the members, provide free testing strips so that, as benefit consultants, we're risk managers for our clients. And one of those, ticking time bombs, if you will, is often diabetics. I think the statistics show there's something like a diabetic on average costs about 4 times the average member. And it's often due to the fact that they go unmanaged. And so anytime we can align the incentives to say, hey, managing your diabetes is free, you can get your insulins through Canadian Pharmacy at $0 copay. You can get free diabetic testing supplies and coaching through DiaThrive. Now all of a sudden they don't have an excuse to not manage that diabetic instance that they have going on with them. So diabetes is one of those that often leads to emergency room visits. And so that's why we've built this into the plan is, from a risk management perspective, providing those free diabetic testing supplies, insulins, and coaching is a small cost to pay versus that $10,000 ER visit that, because it's gone unmanaged, all of a sudden now we have to pay 10, 20x more than we should have if we would have just managed it along the way. Mike, anything to add there?
Yeah, I mean, I agree with you 100% that unmanaged diabetes represents a huge risk for the plan. And once again, I've seen on plans that I've been consultant on, and then also, from working at my mom's primary care office, those patients who struggle to manage their diabetes because of how much everything inside of it costs. I remember we had a person at my mom's office who used to come in regularly because his employer only offered a health savings account plan and they didn't offer any contribution towards the HSA. So that creates a pretty large donut hole, which is a big problem for someone who's a diabetic, which, we as consultants need to keep in mind. And he used to come in and one of the things, luckily, the owner of the doctor's office I worked in was very generous. So was my mom, and they would help, we would get, like, they're called like samples of drugs. So like if you have drugs, the drug reps come in and they give you samples, and we had like diabetes supplies vendors. Cause obviously one of the ways that primary care offices make money is DME. And so we would get samples of all these things. And the poor guy really was so tight on his budget that he would have to come in and I would have to give him these bags of samples and request it from the diabetes testing company for him to even be able to come in and get all that stuff because he was at the point where he couldn't really afford it. So having this available to the members at no cost is important because as a diabetic, there's just costs associated with that. And a lot of times, given the economic conditions, these employers may not be completely aware of the impact that the health insurance plan has directly on the finances of the members who are diabetic.
Yeah, it's crazy to think about, but these are real things that members on our health plans have to make decisions about each and every day, each and every week is, hey, do I want to manage my condition or do I want to put food on my table for myself or my family? And as we move forward with inflation where it's at, with the economic environment that we're in and moving into, these problems and these decisions are only going to get bigger, and they're only going to continue to impact the health plans that we're trying to manage. So next is the big one, obviously near and dear to my heart, cancer. We all know somebody that's been impacted by cancer. One of the more recent partnerships that we've developed at Excel Health Plans is with BenefitSmart. And what BenefitSmart is similar to what Coral is for the MSK and orthopedic space. They have a number of relationships with cancer treatment facilities across the country that are similar to bundled pricing. They're priced at a fair price to the health plan. And so when members choose to use the BenefitSmart network for their cancer care, that comes with the disappearing deductible. Mike, anything to add on BenefitSmart?
Yeah, quite a few things. BenefitSmart is pretty dynamic. Right now they're in over 28 states right now. And really similarly to Coral, as all you benefits consultants may imagine, they're pretty much non-facility based cancer treatment across the board. Not exclusively true. There's still, a small handful of hospital systems that play ball with them. But in general, it's the same concept. As you benefits consultants will not be surprised to hear that the hospital systems like to buy and bill on the chemo drugs, and they like charging $130,000 for a drug that we can buy through the specialty pharmacy for $30,000. And as none of you will be shocked, they're not particularly interested in giving that up. And it is, like in Denver, we have one that they're contracted with called Rocky Mountain Cancer Centers, which is an independently owned and operated. And when I say it's independently owned, they have the model that we like the best. It's a mutual company. So the cancer center is owned by the providers who run it, which many of these oncology clinics are. And their pricing is 140% of Medicare or less across the board in totality. And members can get really all levels of cancer treatment there. They can get, meetings with oncologists. They can get chemotherapy and any type of infusion. They can get radiation, and they can get surgery related to the types of cancer care, all at these facilities.
Yeah, so pretty awesome, in my opinion, benefit. The last thing people want to worry about when they're dealing with, well, any health condition for that matter, but cancer especially, is their finances. And so when we can provide a way for them to get and seek their cancer care at a price that's not going to break the bank, that's a pretty big deal, because you guys are all familiar with the statistics. It's something like 3/4 of all medical bankruptcies are tied to medical debt, and of those, I think it's like 2/3 have insurance. So it's like, if insurance can't protect you from going into bankruptcy, is it actually even insurance at all? And so we find on groups that we're quoting regularly, there's so many people out there that are functionally uninsured because they couldn't afford the deductible if they had to pay it.
Yeah, and I would say that's going to continue to be the case for more and more people, where they don't have. I mean, a lot of people right now, guys, like if they're on a plan and you're in there, like you need to frame it up to the group as like someone gets cancer, they've got $600 in their bank account, and they've got a $6,500 exposure. A lot of these people probably are so close to their credit limits on the credit card that they can't even afford to put that $6,000 on their credit cards. We as benefits consultants in general are a pretty blessed industry. Most of us aren't hurting to that extent. So, just understand that message can be a powerful one. And then the other thing I like to expand on a little bit is just like there's total flexibility with Benefits Smart. So like we have a member here in Dallas. I'm in Dallas at the moment meeting with Assured Benefits, and they're seeing an oncologist from a health system. So one thing for you all to make sure of when you're dealing with that person who has cancer, is like, as you all know, like they're pretty worried. Dylan, obviously you can relate to, the level of fear, anxiety, and stress in there when you get told that you have cancer and the way that feeds through the family. And the great thing about the way the plans work is they can go see really any oncologist they want. On XL Health Plans, we've got the broad PPO. So if they want to go see the oncologist at, MD Anderson or whatever, they totally can. But it's important for you as benefits consultants to set the table with the group but after they go see the consultant at MD Anderson or Mayo Clinic, or like Dylan got all his care at University of Iowa Medical Center, like you don't have to go there for your treatment. That oncologist just sets the protocol for what's going on. And then he says, I want you to take this much of this drug, that much of that drug. I mean, Dylan, you can hop into that. But the thing is that a member can break up that care is my primary point. They can see an oncologist who isn't in the Benefits Smart network, but still have all of the infusions, surgery, or radiation treatment, or obviously medication. Some typically comes from other places, although Benefits Smart can help with like some types of medication. They can get all of those from our different procurement sectors at whatever protocol the oncologist wants, from all of our vendors, and then the member still is able to access all that care for free. So all they're paying for is office visits to their oncologist. So I think that's a very important thing to know.
Yeah. Yep. Most of cancer care can be defined in those three buckets, and I think Benefits Smart does a really good job of addressing all three of them. So, the next thing is something that we definitely dread seeing come up on our health plans, but kidney disease and dialysis, when it does come up, you need to be ready because that is definitely a shock claim. Mike, anything there?
Yeah, I mean, just so you guys know, and that one is part of the disappearing deductible, but also for you all to know, it is the only thing in here that is like hard carved out, which to be frank with everybody, it's not a big deal on the plan because like there's just basically a duopoly in dialysis where there's two companies that provide basically all of the dialysis nationwide. And we work with a vendor called SCM, Specialty Care Management, and they basically get the dialysis for, once again, actually probably slightly lower than what a reference-based price plan would for dialysis. It runs between $190,000 and $220,000 a year. Should you get someone brand new who's on dialysis, and to put that as perspective, for most benefits consultants through a PPO network, you're probably looking at $350 to $550 a year a person on dialysis. So we are getting a good price on that. And the access will not be an issue. So if they need to go to either of the two providers, we have that pricing with both of them. And then if the member has had the condition long enough, if you're taking over a new group that they are eligible for Medicare, then SCM will help them get signed up for Medicare. So that's that benefit, but it is obviously subject to the disappearing deductible, so the member won't have to pay for their dialysis care, assuming they're going to the preferred locations.
Perfect. And then
just don't do it in the hospital.
And then the big one is, like I mentioned earlier, savings on the drug side is often referred to as the low-hanging fruit, and that's simply because the drugs on PPO BUCA type plans are just marked up, and there's so many different ways that those big PBMs are making money on a single prescription. I've heard upwards of 60 different ways that they can make money on a single prescription. So simply by moving them to a pass-through PBM, first and foremost, huge savings right off the top, and then working with script sourcing to source over 1,200 specialty maintenance and name brand medications, just once again realigns those economic incentives where they can get the exact same medication from an alternative source, and it comes with a $0 copay to the member. And then lastly, the durable medical equipment. We use Connect DME in our health plans, and that allows members to get all sorts of different durable medical equipment at a $0 cost to them, and through Connect DME, that it's effectively wholesale pricing. We did have one question. Who's our PBM? Typically, our PBM of choice is Veris RX. So it's a sister company of our TPA, Assured Benefits Administrators. They're based out of Dallas, Texas, where Mike is visiting on site today. I'll be there later this week. One of the biggest things that we like about them, other than the fact that we're working with a transparent contract and passing through the rebates, is we can turn these groups around in really short order. So a lot of our smaller groups, again, for those of you that don't know, we can quote all the way down to 5 employee lives with no participation minimums. Yes, you heard that correctly, 5 employee lives and no participation minimums. So it opens us up for a lot of opportunities that are hard to find alternative solutions for, just because of that participation rule that applies to a lot of other carriers out there. So, restaurant groups, long-term or skilled nursing facilities, we do write a fair number of those groups. Hospitality industry is another one that we've wrote a fair amount of business in. And by working with Veris, they're tied in super tight with ABA in terms of sharing eligibility. And so in a matter of 4 or 5 business days, we can share that eligibility and have the plan up and running. So if a group closes on the 22nd or the 23rd of the month before their effective date, we can have the plan up and running. And we've proven to be pretty nimble and doing that multiple times, unfortunately. So like I said, a lot of our smaller groups do close between the 10th and the 20th of the month before their effective date. So just comes with the territory that we are working in. All right, Mike, let's move it along here. So we do have a case study to share, and this kind of just goes to show it's something that we see a lot of. This is a group that we wrote for 1/1 of last year, and they were experiencing a what we refer to as a death spiral. So they were having a hard time being competitive in their plumbing marketplace in Texas. Their enrollment had dropped down to 52 on the plan, and they had close to 100 employees. After we presented the numbers, we came in significantly lower in terms of the cost options on a like-to-like plan design. And so by driving those savings on the front end, increased the enrollment from point of quoting, the first quote, to the point of sale and implementation, that enrollment increased by over 30 employees. So improving the coverage to their employees and dependents. And with that, driving significant savings. You can see the numbers here, just comparing the 52 on the plan previously to the 52 that we wrote. There was over $210,000. And so if you equate that over a 3-year, 5-year, 10-year period based on where they were going, and most groups are going 8 to 10% increase every single year versus lower premiums today with a 4 or 5% increase, that's significant savings. Our calculations, if you use those assumptions, shows about $3.5 million savings on an 80 life group over a 10-year period of time. So that's significant dollars and cents we're talking about here.
Yeah, and I think something interesting, Dylan, here with this example is to look at like what that does, the premium, but with the number of people going up. The interesting thing is the total net amount paid was probably the same for the group because they're insuring now so many more people. But the biggest problem the company was having is just the value. So that's the interesting thing for all you benefits consultants out there, is that to know that the bottom line savings from what we've seen across the board from what most of you all are doing is that companies aren't really that interested right now in saving the money. What they're looking for is to get a lot more value out of the plan, because what this company did and what lots of you all have helped your clients do, and this seems to be the trend from what we've seen, is that they're reinvesting the savings or reducing the cost per head of insuring people. And so this company was able to pick up everybody and cover, I think, 100% of the EE only premium, which is why almost everybody enrolled. And because of that, the company is still spending more money. But the most important thing for this company is that their cost of retaining employees, their retention was killing them. This company is a kind of a skilled labor, kind of firm, and in the construction space. So their cost of training a new employee, I talked to the HR director myself, was about $40,000 for a new employee. So that's the thing, is that think about the overhead of how expensive it is to hire someone and not have them stay, is that it costs you $40,000 just to take them in and get them up to speed. So they were able to contribute all of this savings to employee retention. And because they have a free plan, they feel that they're much more competitive to retain their talent. And that's what most of your employers in our mind that's what most of you guys have been doing, where most of the net savings that the companies are getting from what we've seen talking to you all on what you're doing once you get that savings back to the company, is that they're going to take most of the savings and give it back to the employees in richer contributions, reduce premiums back to the employees, because they're just trying to they're trying to retain their talent. That's what the companies can't afford the most, interestingly enough.
Yeah, that's exactly right. I mean, we hear that most companies have already budgeted in for what they were expecting to pay anyway. And so if there's savings there, they're just reinvesting it back into their people. So, or at least a good portion of it. All right, let's move it along here. Stella, I do see your question. The answer to that is it depends on the group size. Our underwriter on the small groups side of things has a little bit more flexibility typically above 25 lives. So I'm not sure if you're talking about a group that would fall under that. But we can definitely talk more about your specific case offline if you'd like. So in terms of what employers get, we've kind of talked through these things about as well as we can. If you have additional questions, feel free to throw them in the chat here. But exactly what we've been talking about: better cash flow, lower expenses, lower risk, and it comes with higher quality care. And like Mike said, employee retention is a huge thing these days, where we've seen, the Great Resignation. Now people are, starting to go back to work because they have to. And so employers are fighting for good people, and we see that across all industries.
Well put. And I think the only thing I'd reiterate off that, Dylan, is just the whole concept of the disappearing deductible in and of itself is an enrichment to the benefits, which really matters to the members. This is kind of a morbid story, but I've taken over a group because a member died because he was on an HSA plan, and the dude died from colon cancer and was unfortunately experiencing rectal bleeding for north of 4 months. But because he had a 6,500 HSA, was in a manufacturing company and made, $20 an hour, was a single parent, he didn't feel like he could afford any of his healthcare costs. And so he procrastinated seeking the care. And, his oncologist told him that it's likely that his colon cancer went, given his symptoms, from stage 2 to stage 4 during those 4 months where he didn't seek care. And the employer, to be blunt, hired me because he felt like he had contributed to the death of his employee, which unfortunately for him, he probably did. And that's the level of impact. I know that's a pretty extreme example that we can make on people by saying you have a disappearing deductible, because that member, if he had a $55 copay to go see an oncologist, or we tell him, hey, even better, you can go see Benefit Smart, and this group is in Denver, obviously, and you can go to Rocky Mountain Cancer Center for free. Like, I promise you that guy would have gone in to go see the doctor if we would have told him that his care is free. And so, we don't want that person to go like that. We want to get them the care they need at the price that we know is reasonable. And that's what we're looking for. And we know a member like that is not going to tell our plan, oh, hey, I got to go to University of Colorado Health System. No, he's going to go to Benefit Smart and get the care where he needs, and we're going to pay 130% of Medicare. And that's what is in the best interest of the employee, the employer, and the macro healthcare system as a whole. That's why we're a part of Health Rosetta and NextGen, and we believe in those missions because that's what we're about.
All righty, let's move it along here, Mike. Yeah, so in terms of what our brokers experience, competitive commissions, we can accommodate in most cases whatever you guys need and what makes sense to serve the group, because we've streamlined and standardized our health plans. So for some of you who may not be as familiar with the structure of our health plans, we have 9 set plan designs. There's three gold, 3 silver, and 3 bronze plans. Because we don't change anything and keep them static, that's what allows us to do census-based underwriting. So we get a member-level census. That's what starts the process. And then the way it works is we work with Verikai. Verikai assigns an individual risk score for each member on that census, and then creates a composite risk score for the group, applies that composite risk score across the 9 plan designs, and that's how we can present 9 rates simultaneously with very limited information. If you have questions about what it takes to, get a quote, feel free to reach out to me. I can add my Calendly link in the chat, or you can reach out to me at dylan@excelhealthplans.com. And so because we've standardized things across the board, it makes it easy to sell because everything's always the same, easy to implement because it's always going to be 1, 2, or 3 of 9 plan designs. And then, post implementation, it's easy to service because, again, it's the same plan document. It's just 1 of 9 plan designs. And so it really streamlines everything from sales implementation and ongoing service. With that, high renewal retention, because the highly managed nature of our plans, allow us to manage the claims and manage the risk that is existing on the plans, where a lot of people out there will tell you the claims are the claims and there's nothing you can do about it. We would tend to disagree with that statement because we've proven it time and time again. You can get, the same treatment at two different places, and the cost deviation in some cases, as we've seen today, is over $100,000. And high group closing rates, we've seen consultants who, had dip their toe in the water in January are now closing, 10, 15 groups in a single quarter. This is resonating with employers across the country. We now have business, I think, in 27 or so states, and there's not a market where employers aren't looking to provide more value to their employees or save money. It's across the board in every industry. As I mentioned earlier, we are doing a Q4 challenge. So for any of those groups enrolled in the fourth quarter, they would be eligible for our Q4 challenge. If you guys have questions about that, let us know. But we do have a couple brokers who have already qualified, and hope that many, many more qualify here in the next month or two. So we got a lot of opportunities in the hopper. I think I looked this morning, and between 11-1 and 12-1, there's over 11,000 lives that have been quoted already. So hopefully we can get a few more of those across the finish line and continue to impact more employers and more people. All right. Any other questions?
I can stop sharing too.
One question I did get the other day, which I thought was a little bit interesting, is how do our plans differ from EDIBS? So many of you may be familiar with the structure of our quotes. It may look familiar if you've quoted maybe through a TPA in the past, or through one of their other general agent type relationships. The 9 plan designs stacked on top of each other. I did get this question earlier this week, and I thought it was a good one. Even though the structure is the same, basically asking, what differs from you guys to EDIBS is like asking, is basically like saying you guys use the same stop loss carrier. How are you guys different? And so even though we are using the same underwriter, our plans are our own, our plan document is our own, and our steerage, everything built within the plan is completely our own. So they do differ in a lot of ways from the standard EDIBS, or maybe you've gotten a quote from a TPA out there. There are a lot of differences, and in most cases, those differences benefit either the plan and or the member. The biggest difference, like we've been hammering home today, is that disappearing deductible.
Yep.
All right. Any last questions? Otherwise, I think we're going to wrap it up. Mike, any last words?
I don't think so. I think we covered all the bases. I would just say, we appreciate everybody's support, and that from our whole team at XL Health Plans. We really appreciate your guys' embrace of XL Health Plans and willingness to go take it out to the market. It's been a vision in my head for a while, and it's fun to be a part of the process of building it out, and you guys are an important part of that process.
Absolutely. We will be posting the restream of this, so there will be a replay. It'll be on YouTube. So if you know a consultant in your office, or maybe a non-competitive consultant that you know from a conference or something, and think they may be interested in XL Health Plans, feel free to share this out. Feel free to make an introduction to them if they have questions. We're happy to work with anybody who's mission aligned. That's the key focus for us, is really working with mission aligned brokers and consultants, because we know that those are the people that we align best with. And we've proven that time and time again. We're not looking to just be included on a spreadsheet and treated as just another guy out there. We want to walk the talk that you guys are talking about on LinkedIn, talking about to your clients over the last 3 to 5 years. Many of you have been sharing this story of like, hey, there's a plan out there that can do more, and we've put all the pieces together to be able to do it for you. So like Mike said, thank you everyone that's continued to support us. If you have any questions, reach out, and we can turn things around for you in short order. All right, guys.
That's it for me.
Signing off. Make it an excellent day. No pun intended.
Adios, guys.